Namaskar and welcome to India Science. It is our endeavor to take scientific tempo across to the country. Today we bring to you a candid conversation with Director General Icmr, one of India's premier research institutes, Dr. Balram Bhargava. As India battles COVID-19, let's hear an update from him. We are indeed privileged to have you here with us today. Thank you so much for joining us on India Science. Sir, what is your update on the pandemic and how does Icmr see the pandemic rolling out in the next phase?
In terms of the update on the pandemic, we are really still in the midst of it. It has been more than 6 months since the pandemic has started. Earlier, it was focused mainly on the mega cities with international airports, with people returning from abroad. Now, gradually and with movement outside, to tier 1, tier 2 cities, and also to the interiors, it is spreading. Having said that, this pandemic, as far as India is concerned, we have performed fairly well despite the limited health resources in the country. We have been able to impose a complete lockdown in a very timely manner, and this lockdown has been helpful in, as I always say, that it has been helpful in distributing the curve as we speak of this disease in the country. And therefore, with such a large population, with such limited healthcare facilities, we have performed well, and the mortality rate is amongst the lowest in the world. With as we speak, it's about 1.8%, and that is one of the lowest, and therefore I think we have done well as a nation. More importantly, we have worked in a calibrated fashion, in a unified fashion, and the Honorable Prime Minister has led the nation from the front, and all the state chief ministers have been supporting him in every which way that we have more. The other point that I would like to emphasize here, during this pandemic, we've had several floods. We've had Amphan in West Bengal. We've had a cyclone in Maharashtra. We've had several floods that have happened. We've had incursions in China, and despite these unpredictable influences, the country has held together very well, and I think under the able leadership of our Honorable Prime Minister, it has demonstrated that it is really united with tremendous amount of diversity, and has shown grit and courage at every level.
Absolutely, sir. As you said, pandemics have a way of uniting everybody, and all of us are always thinking कि अब क्या होगा, आगे क्या होगा. और यहाँ पे मैं आपसे जानना चाहूँगी that your premier institute has got about 32 subdivisions to it all across India. And what can you tell us more about the labs and the infrastructure that you have managed to build up even during these COVID times? That is really commendable.
Yes, that has been a great achievement from all our scientists and all our scientific community of the nation. From the Indian Council of Medical Research's perspective, we are a 108-year-old organization who have been and have about 26 institutes distributed across the country on various disciplines. And the primary institute for this viral diagnosis has been the National Institute of Virology at Pune, and that was in January the only testing laboratory for COVID-19, and gradually we have upscaled our viral research laboratory network within the country, and we have had help and contributions from all our scientific organizations, whether it be the Department of Science Technology, DBT, CSIR, DRDO, ICAR, MHRD. They have played a stellar role as well in helping India develop and set up about 1,500 laboratories as we speak, with testing up to 1 million tests, with the capability of testing up to 1 million tests as we speak. and that has been a huge Herculean effort. As far as the Icmr is concerned, I can clearly say from my personal experience, for the last 6 months, everyone has been working 24/7. There has been no Saturday, no Sunday, and all the institutes have really plugged in and demonstrated that they can work very efficiently when the need arises.
बिल्कुल जैसे आपने कहा, it is because of doctors like you and the entire medical fraternity. I would say kudos to all of them, having shown the kind of resilience और जिस तरह की लगन आप लोगों ने दिखाई है वो काबिले तारीफ़ है बिल्कुल. मगर यहाँ मैं आपसे एक और सवाल जानना चाहूँगी इसी के चलते हुए कि इस फ्लू से दहशत सी फैल गई है all across the globe. People are so scared. So what is so different about this and the other flus that have been phasing out? अगर common man को समझाना चाहें, because it is the same family. And the silver lining, as you said, is that the mortality rate in India is very low. It's 1.8%. That is indeed a silver lining. But how do you explain the flu? कि किस तरह से लोग इसको देखें?
The problem with this COVID-19 is that it is highly infectious. It spreads ruthlessly, as I would say. It can spread very ruthlessly, and from the virus's perspective, it's an effortless spread for the virus. Having said that, about 85% of the people will recover on their own or with some supportive care. About 15% of the people will require some supportive care, and the most important treatment for them is really oxygen, oxygen, oxygen. And about 2% patients would really require serious treatment, and they are the ones which can land into problems. Now, India has a large population, and therefore we are worried about it in every which way.
Right, sir, but as we speak, the WHO said test, 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 and I think India and all of you are advocating test, isolate and trace. So what is the exact difference, if you could quantify on that?
Sure, I think the basic principle since as I mentioned that this virus has tremendous capacity to spread, so it is important to test, 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 and that is a very important dictum as the first part of it. Then we have to track those people, test, track, trace, track and treat, and then technology. I call it 5 T's. So you have to test those people, trace them, track them and isolate them so that they are not further spreading to other people. And once they do develop symptoms, then treatment is very, very important, and the use of technology like Arogya Setu, etc. are very useful for isolating. For each one of them, for tracking them as well as for tracing them as well as for getting them into isolating them.
When you isolate them, sir, you said about the urban slum areas a little while back. How do you look at it phasing out there now? I mean, and even the rural slum areas?
Sure. I think in the slum areas, fortunately, we've had the earliest experience that we have in India was in Dharavi, and there the test, track, trace was done well, and they were able to isolate it, and that was one of the success stories of India, I would say, and they have done phenomenally well. Similarly, in the middle of June, we found that Delhi was deteriorating tremendously, and we were getting a large number of cases, and these are mega cities as we speak, population of about 2 crores, more than several countries of the world. And there also we found that in Delhi we were very aggressive in testing, and fortunately at that point in time we had a rapid test available which we were able to deploy, and under the able leadership of the Honorable Home Minister, who was deputed by the Prime Minister to just take it over. And it was a classic example of central state collaboration where we were able to control Delhi phenomenally well, and the NCR regions of UP, Himachal, Haryana, as well as the neighboring states, where the neighboring districts as we speak, and aggressive testing there was responsible for controlling it. And that aggressive testing was because of the rapid antigen test at that point in time, which had just been deployed and validated by the council, and that worked well for the country.
We'll talk a little more of the tests in a while. We're going in for a short break. Stay tuned. When we come back, we'll talk more to Dr. Balram Bhargava about testing and about RT-PCR.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
Welcome back, and we are in conversation with Dr. Balram Bhargava, and we were talking to him about testing just before we went for the break. Sir, before the break you spoke a little about testing. I want to ask you now, sir, is people want to know about testing in international, on the global scene vis-a-vis India, and how do you see COVID-19 in India vis-a-vis the world arena?
Yeah, I think we've talked about our successes in terms of the mortality. In terms of testing, I think initially we started, as I said, with very small numbers, but gradually, as we speak today, I think our numbers, total numbers of testing is probably one of the highest in the world, and we've once at a spike of when we crossed 1 million, we even crossed the United States of America in terms of testing, and the total number of tests still are higher than many countries like Russia, United Kingdom, and many countries in Europe, South Korea. But we have to clearly remember that we have a large population, and we still have tested a very small percentage of the population who require the test. Having said that, we are much beyond the testing numbers as far as the WHO norm is concerned. Because WHO norm is about 140 tests per million population, and we are somewhere around 600 tests per million population as the country. However, there are certain pockets where we still have to do much better. We have tried to establish laboratories and testing centers at the northeast in remote areas like Ladakh. We are setting up a new lab in Kargil, in Andaman Nicobar Islands, as well as in remote areas of UP and Bihar. So we have been working on that. As I mentioned, all the agencies, all the science agencies, the medical colleges have contributed immensely in helping us set up those labs. So from that perspective, I think we are at par with the international level, clearly. But you mentioned about the inadequate healthcare facilities. And that is one point which has come into focus at this time of the pandemic, that we could have been better prepared in terms of creating the health infrastructure in this country. Because as we should remember one thing, that in the Second World War, about 80 million people died. 3% of the world population was wiped out. Learning from the Second World War, the United States of America set up their huge chain of Veterans Administration hospitals, which they spent about $50 billion on setting up those hospitals. They created a new cadre rank for doctors, glorified them in every which way. Similarly, that Veterans Administration spends about $2 million on research. They took the same opportunity to set up the National Institutes of Health, which is something like the on the patterns of the Icmr with several institutes, and so they set up the National Institutes of Health at the budget of $42 billion purely into research. The United Kingdom after the Second World War took the opportunity and set up the National Health Service. The state-of-the-art hospitals, public funded, which have been contributing immensely to not only the United Kingdom but Europe, and many people visit to the hospitals in the NHS system. So that was set up 75 years back. Now I personally feel that this is an opportunity for India. COVID is a war, and take the advantage of this war and set up or maintain our hospitals which are there, our medical colleges, our district hospitals, our public health infrastructure, right at the primary, secondary and tertiary care level, which was perceived after our independence by the Bohr Commission report, and that needs to be fostered in every which way. Our healthcare budget has to be improved, and the Honorable Prime Minister has promised it to increase from 1% to 2.5% of the GDP. But if you look at the healthcare budget of the United States, it's 19% of a $19 trillion economy. UK is somewhere around 8-9% of their GDP.
Right.
So I think we have to definitely increase our healthcare budget. At this time, take this war or this pandemic as an opportunity to spruce up our healthcare systems in every which way, so that you never know which virus we are dealing with tomorrow. So that is, I think, an opportunity, and I think the government has taken cognizance of this in every which way, and we hope for the best as far as that is concerned.
Absolutely. As you said, COVID is a war and we're all battling it, but India has done so well, and you've all been at a war footing to kind of put systems in place, and I think we're going the right way. As you mentioned, Prime Minister has also spoken about Atmanirbhar Bharat. How self-reliant do you think India is in manufacturing, since you're heading the institution which is doing the most amount of research as we talk, even during these pandemic and lockdown times? So I would like to request you, sir, to let us know and the viewers know what is the state of research as far as vaccines are, this is on the mind of every Indian.
Sure. I think that's a very valid point which you're bringing up, and that was exactly what we faced in the end of March and early April, when we had to import testing kits. And at that point in time, the Ministry of External Affairs, the Ministry of Civil Aviation helped us tremendously to get testing kits from abroad. But during this span of 6 months, we have seen all our science agencies, all our startups, youngsters develop new kits, and we've validated more than 700 kits, out of which about 50% are indigenous, and they have brought down the cost of testing tremendously, because what has happened at that time, one test, RT-PCR test, the cost of that was about 1700 rupees, and today it is about 300 rupees. Because the Indian manufacturers have done very well, they have brought in those kits, number one. Once they have brought in at a lower cost, the international players have also brought their cost down. So from that perspective, I see no reason why our scientists, our researchers, our doctors cannot be at par with anywhere else in the world. Coming to your point about vaccine development, and I think in terms of vaccine development, India, as we speak, is spoken of as the pharmacy of the world.
Right, sir.
But for vaccines also, we are making about 60% of the vaccines for the world are made in India. But more important is, are we at the cutting edge in terms of research for developing new vaccines? I would say yes. We are having 3 vaccines which are in India, which are in the different phases of clinical testing. In fact, two of them are purely indigenous. One is the Oxford vaccine, which is being investigated in India and now has to be scaled up by Indian manufacturers. And we also have another 3 or 4 which are in the preclinical stages of testing. So I see no reason why we should not recognize our researchers, our scientists, we have to motivate them and encourage them so that they do deliver for the country, because we are a large population and we would need them the most as we speak.
बिल्कुल ऐसे ही बनेगा आत्मनिर्भर भारत. यहाँ मैं आपसे ये जानना चाहूँगी सर, you had a lot of people in ICMR going in for HCQ. How do you see that as a drug?
Yeah, the HCQ story is an interesting story. What happened is that HCQ, we had discussions. We had created a national task force to decide the treatment along with the joint monitoring group from the Ministry of Health, and we had experts of virology, epidemiology, clinical experts, pulmonology experts, and several other operational research experts who are part of the national task force from all over the country, not just the ICMR, all over the country in different medical colleges, etc. And we've been meeting very regularly, maybe every week or every 10 days, and deciding on different aspects. Hydroxychloroquine was one of the first ones we thought and discussed, and we felt that it is probably having one, biological plausibility to use, two, in vitro testing that has been shown that it is useful. This was, I'm talking about March, April. And at that point in time we said that yes, we do feel that it may be useful for prophylaxis of this disease and once a week dose for prevention of this disease. Subsequently, we had some operational research data looking positive. We had some international data looking at it positive and on both sides. Then we had the large study which was against it but then was withdrawn, which everyone knows was published in Lancet and New England Journal, and then it was retracted because the data was not appropriate. So as we speak today, we still do recommend it for prevention, and we still don't have very strong evidence to support this.
Absolutely. We are going in for a short break. Stay with us. When we come back, we'll ask Dr. Bhargava about his vision of ICMR and about plasma therapy. Stay tuned.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
Welcome back, and we are in conversation with Dr. Balram Bhargava. Sir, I'd like to know from you a little bit about plasma therapy and how it's going to help, everybody. People want to know.
Yes, plasma therapy, or what we call convalescent plasma, has been used for over a century actually,
right,
for treating these kind of infections. But there is not very strong evidence for the same. We have recently concluded a very large randomized trial on about 450 patients, where 225 were given plasma therapy and 225 were not given plasma therapy. And we are awaiting, and we are finally collating the results of that, and they should be available very soon. And this is probably the largest study done on plasma therapy anywhere in the world. And I think 39 hospitals have participated in that, and they have done a very meticulous role in collecting the data, treating these patients, and we are analyzing all that data, and hopefully in a week or two we should have more detailed.
More figures. I'd like to leave our viewers lastly with your vision of healthcare in India. किस तरह की कल्पना आप करते हैं आत्मनिर्भर भारत की, अगर हेल्थ सेक्टर को देखा जाए कैसा होगा ये विकसित भारत?
Good point. I think we are dealing with a pandemic. Once this is over, we will have to get back to our routine things in terms of dealing with malaria, filaria, leprosy, tuberculosis. We have had a call by the Honorable Prime Minister that we have to eliminate tuberculosis by 2025. That is a lot of hard work. We've started the largest tuberculosis prevalence study. We have also started a vaccination study for tuberculosis. So that is, I think, the next agenda after COVID has to be tuberculosis. Malaria, we are doing well as far as the country is concerned, but we will have to do better and maybe work on that. We would have to work on childhood nutrition and the first 1,000 days of the child, and that is the Poshan Abhiyan, and concentrate on that. And the non-communicable diseases, which is obesity, diabetes, hypertension and heart disease are here to stay, and they have already overtaken the communicable diseases, except this huge viral outbreak that has about. We are going to, as Icmr, trying to set up more viral research facilities in the country. We have a BSL-4 lab, which is state of the art. That was the first in the Southeast Asia in 2011, and that is what has been responsible for helping in this program as we speak. And we want to set up more of those. As a nation, if more funds are allocated for healthcare and the public sector healthcare is improved, and people start having more faith in the public healthcare system, which whether it be the district hospitals, the medical colleges, the primary healthcare centers, the Ayushman Bharat, all these are I think brilliant programs. If they can be nurtured, I think we have a very bright future ahead. Thank you so much.
And on that note, more power to you, more power to Icmr, and thank you so much for joining us for this very, very insightful and interesting conversation.
Thank you.
Namaste.
Thank you.
And I'd like to leave our viewers with these lines. The pandemic has really united us. मगर आखिर में जीतेगा भारत, हारेगा कोरोना. इसी के साथ ही नमस्कार. Thank you for watching India Science.